Greetings, students, and welcome to our module on funding for substance abuse and mental health services. I'm going to try and move through these slides pretty quickly, keeping in mind that you guys also have another video to view for this week. Want to start by taking a look at this graph. Now, all of the things that you see, all of the charts that you're going to be seeing for at least the first 3 quarters or so of these slides will be from the Substance Abuse and Mental Health Services Administration in their report that they do periodically that provides information on mental health and substance abuse expenditures or behavioral health expenditures in the United States. So all of these charts and graphs come from that source, and you'll find that in your module for today. When I've shown this graph in the past to our students, and especially, they update this every several years, so I've actually been showing this graph, I want to say since like 2013 probably, or 2012 with students. And I always ask the question, when you look at this graph, do you see any dips or decreases in spending on mental health and substance use disorder spending? Keep in mind, when you look at these abbreviations here at the top, you have MH/SUD for mental health and substance use disorder spending. And we're looking at the span of time from 1986 to 2014. You see in the blue dashed line here, we have all health growth and spending. The solid red is mental health and substance use disorder, and the yellow is the GDP inflation rate, which basically is it's the gross domestic product, which sort of gives you a gauge for cost of living in the United States. So I ask students to look at this chart and then answer the question, do you see any points between 1986 and 2014 in which spending on mental health and substance use disorder treatment decreased? So take a look at the graph for a moment and see if you can answer that question. Do you see any points where spending on mental health and substance use disorders decreased? Well, students almost always answer that question with yes, they do see points where spending decreases. And they'll particularly point out this year, 1996, where there's a dip in the graph, and they'll also point out this section and so forth. And they'll say, so yes, spending decreased. But actually that is not true. See, this chart is a little bit misleading because if you look at the top of the chart, it says annual growth in all health and mental health substance use disorder spending. So in other words, this chart is showing you how much did spending increase each year. And you'll notice the graph does not go any lower than 0%. So in other words, there are no negative numbers here, and if there are no negative numbers, then that means that growth in spending never decreased. So no matter what, every year from 1986 all the way to 2014, mental health and substance abuse spending increased each year over the previous year. The increase was the smallest in 1996, just a fraction of a percent, but nonetheless, every single year since 1986, spending on mental health and substance abuse treatment has increased over the previous year. And that is, to me, just sort of mind-boggling. There's never been a year where we spent any less on mental health and substance abuse treatment than we did in the previous year. And that's all the more clear when you really look at the intricacies of this graph. Okay, so let's move on here to the next slide. Oh, if I can get this to work anyway. Okay, so mental health and substance use disorder shares of all health spending. What you see in this graph is a red line that signifies substance use disorder spending, and then you see the blue dashed line is mental health, and then combined mental health and substance use disorder is the yellow line. Well, what you see on the left-hand side here is the percentage of the share of all health spending. So when we talk about all health spending, we're talking about not only mental health and substance abuse spending, but we're also talking about spending in all other areas of health, or the healthcare industry basically in the United States. So as you can see, substance abuse treatment is a much smaller share of all health spending than mental health treatment is. Which kind of makes sense, because if you think about it, if you look at the DSM, for example, substance use disorders are a small fraction of all of the different disorders that you'll see in the Diagnostic and Statistical Manual of Mental Disorders. So the next chart, growth in private insurance spending for all health and mental health and substance use disorders. So what you will notice on this graph is, again, pay close attention to the verbiage growth in. So again, this chart, even if you see a dip on this chart, that doesn't mean that private insurance spent any less on treatment than they did in the previous year. The only time it will mean that is if you see the chart go below 0% here. And you can see there are 2 years where insurance actually spent less money on mental health and substance use disorder treatment than in the previous year, and those 2 years were 1991 and 1992. But other than those 2 years, every single year from 1986 to 2014, private insurance has spent more money on mental health and substance use disorder treatment than it did in the previous year. So insurance has been spending more and more money every year since 1986 on mental health and substance use disorder treatment, with the exception of 2 years in 1991 and 1992. So again, this helps to illustrate that we are spending more and more and more money, and that insurance is no exception. There are many people who believe that insurance is getting more and more stingy and spending less and less money on mental health and substance use disorder treatment. And, you know, depending on how you look at it, you could still argue that they're becoming more stingy, but the bottom line is they spend more every year on mental health and substance abuse treatment than they did in the previous year. Similarly, here we have a different chart that looks at public spending. And what you will see in this chart is the same thing that you saw in our first chart. Every year since 1986, public spending has increased in mental health and substance use disorders in comparison to the previous year. So public spending, of course, would be any spending of public money, and that basically means tax revenue, money that the government gets from citizens, whether it be local government, state government, or federal government. Other state and local spending in millions for mental health substance use disorder treatment. So you see similarly here, we're looking at growth in, or the red line anyway, is your percentage of growth in mental health and substance use disorder treatment among state and local government public funds. So think about your state, Florida, your county, maybe Hillsborough, maybe Pinellas or Manatee, and wherever you're at, and then the city that you live in. If you look at all those levels of local government, spending has increased religiously and consistently every year over the previous year since 1986. Now let's look at public and private spending in billions on mental health and all health treatment in 2014. And when you look on the pie graph on the right, you see all health spending. So again, this is spending on any kind of treatment whatsoever, any kind of health care in the United States. And as you can see, it's about half funded by taxpayer dollars and about half funded by private spending, whether that be out-of-pocket expenses or insurance expenses. But that is not the case in the pie graph that you see on the left for mental health spending. Mental health spending is disproportionately reliant on public funds compared to private funds when you compare it to all health spending, with 59% of funds on mental health treatment being public funds. Now I put, there's a previous version of this presentation that I used to give where we only had charts going up to 2009 because that's all that Substance Abuse and Mental Health Services Administration had available for us. So you can see in 2009 a pie graph that shows you what percentage of mental health treatment comes from which payer. And in 2009, private insurance, or actually Medicaid, was your single greatest funder or payer of mental health treatment, with 27% of all spending on mental health treatment being spent by Medicaid. Second was private insurance companies at 26%. Third was Medicare at 13%. And other state and local funds were only 15% in 2009. Out-of-pocket was 11%, which means that the average U.S. citizen, or actually American citizens, were only paying out-of-pocket for about 11% of the total amount of spending on mental health treatment that year. Now, if you compare that to the new chart that shows the year 2014, which is the most recent year that you'll find in SAMHSA's report, private insurance accounted for 28%, which is about the same as what they were paying in 2009 in terms of the percentage of their share. And you see a similar number for out-of-pocket expenses, similar number for Medicaid and Medicare, but you'll see Medicaid dropped a tiny bit and Medicare increased a tiny bit, and so it's really about the same as what you saw in 2009. Not a whole lot's changed in terms of the percentage of mental health treatment being paid by which payer source. So let's see what we have here. Shares of other state and local mental health spending decreased from 1986 to 2014, whereas shares of Medicaid, Medicare, and private insurance increased. So what you see here in this top section, this is your state and local government funds. If you go back to 1986, 27% of all mental health treatment was funded by state and local government. But that's not the case in 2014, where we have 13%. So state and local governments have been shouldering a smaller and smaller percentage of the burden of mental health treatment funds as time goes along here. But if you look at Medicaid, Medicaid has been expanding and paying more and more in comparison to 1986 of mental health treatment. Other federal funds are about the same. They're pretty consistent over time. Other private is pretty consistent over time. Private insurance has increased too. Private insurance in 1986 only paid about 20% of all mental health spending. But if you go to 2014, they're at 28%. Whereas out-of-pocket has reduced substantially from 1986. In 1986, 18% of all spending on mental health treatment was out-of-pocket, direct from patient to provider. But in 2014, it's only 10%, and this helps to illustrate a concept that I'll be repeating throughout the semester, that increasingly mental health treatment is a third-party payer industry. Only 10% of mental health treatment was out-of-pocket expenditure in 2014. It is largely a third-party payer system nowadays. And what we mean by third-party payer is somebody besides the patient and the provider is funding the patient's treatment. Third party is anytime anybody besides the patient is directly paying the provider. And that could be insurance, it could be some kind of government payer source, it could be some kind of charitable program, but those are all third parties. It's not a third party scenario if the patient is directly funding their own treatment with the provider. And that's becoming rarer and rarer in the United States. So private insurance and Medicaid contributed the most to mental health spending increases from 1986 to 2014. Again, these are both third-party payers. Medicaid, which is government-funded insurance, usually for low-income citizens, and then we have private insurance companies spending more and more over that period of time. And that's part of, by the way, that's part of why insurance is becoming more and more expensive, because insurance is having to pay more and more and more for treatment over time. So in order to compensate for that, your insurance premiums for healthcare keep increasing over and over again. You'll hear me talk about this more in class, but a few years ago, actually about four or 5 years ago, I used to only pay $89 a month for insurance when I went into private practice, but now I pay $500 a month for insurance. It's amazing how much my insurance has increased over the past several years. So now let's look at the different types of providers that are getting whatever slice of the pie for mental health spending in the year 2014. So the largest percentage that you will see is a split, a tie between retail prescription drugs, which accounts for 27% of all mental health spending in 2014, and hospital care, which is another 27% of all mental health spending in 2014. So hospital stays, even though the vast majority of clients who were treated for mental health in 2014 were not hospitalized, hospital care is very, very expensive, so it drains a very substantial portion of funding. But also prescription medication is a huge chunk, an equally large chunk actually. And then we get our office-based professionals. So these would be, for example, your therapists working in offices, or your psychiatrists or primary care physicians who are prescribing medications and so forth. And then we have your specialty centers, and these would be centers like residential programs and that sort of thing. And then we have insurance administration, 9%. So literally 9% of all the spending on mental health treatment is pushing paperwork for third-party payers, figuring out who's going to be paying what and when and how much and those sorts of things. It costs money to have an industry like that of third-party payers, and this is all just administrative fees right here. And then we get your long-term care at 7%. So now we move on to our growth in prescription drug spending. So again, the key word here is growth. And so unless you see something dip below 0%, you can assume that in each year we're spending more, we're growing in comparison to the previous year. Even though you see that these lines come down, that just means we grew less this year than say this year. But we still grew because it's still above 0%. So our blue line, our blue dashed line, is all health spending on prescription drugs. And then our red solid line is mental health spending from 1986 to 2014. So again, with the exception of 2013, where there was about no growth in spending, each year we've spent more on prescription medication than we did in the previous year. So we're spending more and more on healthcare each year. Of course, our population's growing each year, and inflation happens also, so that's part of why we're spending more every year. Certainly, that's a big piece of a big part of the explanation, but it's not the only explanation. So from 2008 to 2014, the share of mental health medication spending for antidepressant medications decreased whereas the share for antipsychotics and stimulants increased. So what you see here is this sort of yellow color is other medications, which increased in terms of their share of spending. The blue bars are antidepressant medications. So antidepressant medications, we account for a smaller percentage of spending and prescriptions in 2014 compared to 2008. And there's a reason for that we'll get to later. Stimulants, though, I'm sorry, I gave you the wrong information earlier. This area is stimulant medications, not other medications. Stimulants have increased in spending in between 2008 and 2014. So your stimulants include medications that are prescribed for ADHD, like methylphenidate or Ritalin and Adderall and so forth. So from 86 to 2014, hospital treatment and prescription medications were the largest drivers of the increase in mental health spending. So again, it costs a lot of money to hospitalize somebody, and prescriptions cost a lot of money also. And that is part of the case for stabilizing people on an outpatient basis, rather than waiting until things have gotten so bad that they need to be hospitalized. And during that same time frame, the share of mental health spending on specialty hospitals declined substantially, which I think is another good illustration of the process of deinstitutionalization, the gradual closing down of state hospitals and that sort of thing. Okay, so from 86 to 2014, shares of mental health spending for inpatient and residential settings decreased, and shares for outpatient prescription drugs and insurance administration increased. So again, I think this is another good illustration of deinstitutionalization and the shift of focus on outpatient care versus inpatient care. And also with insurance administration, the fact that we are increasingly a third-party payer healthcare system in the United States, for better or for worse, depending on how you look at it. So compared with all health treatment, substance use disorder treatment depends even more on public spending than mental health. You saw earlier how, again, we have all health spending, about half of it's publicly funded and about half of it is privately funded. When we looked at mental health earlier, we saw that there was more of a focus on public spending. About, I want to say it was around 60% or so, if I remember right. But with substance abuse treatment, we are even more dependent on public spending. And I often ask students, why do you think that is? Why do you think substance abuse treatment is more heavily reliant on public funding versus private funding than mental health treatment? And sometimes a student will kind of guess or be able to answer correctly. A big part of this is that our criminal justice system is very much connected to substance abuse treatment. In Florida, for example, the Florida Department of Law Enforcement estimates that 80% of all of our crime is substance related. Again, that's a big number. 80% of all of our crime in the state of Florida is reportedly substance related. And when you think about that, that's not just possession charges and DUIs, charges that are obviously substance related, but it also includes charges like prostitution, when the only way that somebody can support their habit is through prostitution, or charges like burglary. I had my apartment burglarized when I was young by a friend of mine who used to be a very loyal, honest friend, and I know is a good person, but unfortunately he also became an addict, specifically addicted to benzodiazepines, and he owed so much money to his dealers he couldn't pay off, so he started burglarizing the homes of his friends and family members, sadly. So that burglary would be a substance-related burglary. lots of burglaries are substance related, lots of theft charges, lots of battery charges. And look at domestic charges. This includes the husband, for example, who's only abusive towards his wife and or children if he's intoxicated. So there's an awful lot of crime in the state that is substance related. And so our criminal justice system, which is primarily local and state funding, spends an awful lot of money on substance abuse treatment. Shares of substance use disorder spending from private insurance fell from 86 to 2004, but then rose again from 2004 to 2014. So again, we see that private insurance is funding increasingly a larger and larger percentage of the burden of substance abuse treatment. At least that's been the trend from 2004 to the present. From 86 to 2014, other state and local payment sources and Medicaid contributed the most to increases in substance use disorder spending. So again, this really emphasizes how much of our substance abuse treatment spending is funded by public dollars, public funds. From 2002 to 2014, growth in substance use disorder treatment spending on prescriptions increased substantially. In fact, there wasn't much of any spending at all on it until about 2005. So what started happening around 2005 that contributed to this dramatic increase? And I would submit to you that opioid replacement therapies account for the vast majority of this increase. In fact, we'll see that here in the next slide. In 2014, buprenorphine, or Suboxone, and naloxone contributed were 85% of our spending on prescription drugs for substance use disorders in 2014 were because of that particular medication. And then we have naltrexone, and so it's mostly opioid replacement therapies that we're spending money on for prescription drugs. Now we move on to 2004 to 2013. This is kind of good news, I think. The percentage of adults receiving mental health treatment grew steadily. If you look here at 2004, you will see that about 12.6% of adults in the United States received some kind of mental health treatment. But in 2013, that is it's 14.6%, so a 2-point increase. And I think the reason why you will see this, although most of this is prescription drugs, I think that's the kicker though, is that most of this increase is attributed to prescription medication. You don't see it being inpatient. It's not an increase in inpatient. It's not an increase in outpatient. It's an increase in prescription medication. And I think it's good on one hand that more adults are receiving mental health treatment, because I don't think mental health disorders are on the rise in the United States. I just think that stigma is gradually and slowly reducing, and more people are getting the help that they need. But unfortunately, they're most likely to get that help through prescription medications. And I'm not saying that because I'm anti-medication. I'm certainly not. But I think that a lot of times we look for quick fixes, and we don't necessarily get to root problems, and medications don't necessarily teach us different ways of responding to things in life or coping. And I think that's the part that's missing. Of course, I'm a therapist, so that is going to be my bias, obviously. So from 2004 to 2013, the percentage of adults receiving substance use disorder treatment did not change appreciably, but treatment with prescription medications increased substantially, which again illustrates my point that people look for the quick fix, they look for the pill, but they don't necessarily get to the root of the problem as effectively. And medications come with side effects, and medications don't teach us any new ways of living. And I think that's a limitation of medications, even though I think they're vital in many cases. From 2004 to 2013, mutual support groups were the most common setting in which adults receive substance use disorder treatment. So this kind of helps to illustrate how self-help mutual group or support groups in the world of substance use disorder treatment is still really the primary and most integral modality for recovery, and still going very, very strong. So this is the percentage that is connected to support groups, the solid dark red line there. So let's look more specifically at Florida. Now, when I used to in older versions of this presentation show data that only went up to 2009, you would see that SAMHSA would put out a lot of critical information showing that Florida was just sort of behind the rest of the country in terms of spending on mental health and substance abuse. And then they would draw a correlation between that and worse problems with mental health in the state of Florida. But interestingly, in the new data that's come out, they actually don't even talk about how much money Florida spends on mental health and substance abuse treatment. Instead, we get the message over and over that Florida's not really any worse off than the national average. So they've stopped really putting out information on that correlation between the two. And I don't know if Florida is spending more or is closer to the national average in terms of mental health and substance abuse treatment than it used to be. I don't think it is. But for whatever reasons, we don't seem to be any worse off than the rest of the country. So for example, this is just past month illicit drug use among adolescents aged 12 to 17 in Florida and the United States. The blue bar would be Florida and the red bar is the United States. And as you can see, we're about the same as the national average in terms of the percentage of adolescents who use illicit drugs in the past month. Now look at a pie graph for the past year mental health treatment or counseling among adults aged 18 or older with any mental illness in Florida. And what you will see is that about 63% of Floridians with mental illness didn't receive any kind of treatment from 2010 to 2014, whereas 37% did receive some kind of mental health treatment or counseling. And that to me is really bad news. It would be nice if we saw a very small chunk of this pie graph being red and a very large chunk of it being yellow, I think. Hopefully we will see that in the future. Mental health consumers in Florida and the U.S. reporting improved functioning from treatment received in the public mental health system. So the good news here is that the majority of both minors and adults in Florida and in the U.S. who have participated in some kind of treatment within the public mental health system in 2014 believe that it was helpful for them. So they're reporting improvements in their functioning if they're getting care even in the public mental health system, which personally, my opinion is, you don't necessarily see the highest quality of care in the public mental health system. I think it's okay, it's good enough, it's better than nothing. I think a lot of the private treatment is higher quality, but nonetheless, even in the public system, most people are saying that they functioned better with treatment. Past year illicit drug dependence or abuse. So in other words, think of dependence or abuse as being a substance use disorder in DSM-5 terms. Past year substance use disorders among individuals aged 12 or older in Florida and the U.S., you see that we are pretty similar to the national average. So we don't have any worse a problem with addictive disorders for chemicals than the national average here in Florida. Let's spend a few moments talking a little bit about psychotherapy. This is outdated information because, as you can see, we're comparing 1998 and 2007. And the source here comes from some information published in Psychotherapy Networker. the percentage of the population using psychotherapy did not increase from 1998 to 2007. I wish I had more updated information to tell you, so we could see what about after 2007, did it increase at all? But unfortunately, this is the best I have for right now. And so psychotherapy, if you look at these charts, you'll see that therapy only actually diminished from 1998 to 2007, as well as a combination of therapy and medication, but medication only increased substantially during that time. So what you are seeing is an increase in medication again during that time frame. Now, I guess I might have missed the earlier, hopefully, it seems like I left out a chart, but earlier when we were looking at those charts that deal with spending, prescription medications were dipping in the 90s. In fact, let's go back to that real quick here, because I think that's really important for us to take a look at. So bear with me a second while I find that slide again. Here we go. So this slide, which was the growth in prescription drug spending for mental health and all health from 1986 to 2014, notice that there are points where we don't grow our spending as much than the previous years. So I brought this up earlier where there's a dip here and there's a dip here. Why was there a dip in the 90s? And why did it start increasing so much more actually in the 90s and then start decreasing again going in the 2000s? This chunk of time is when we started getting the selective serotonin reuptake inhibitors, or the SSRIs, and some other newer generations of antidepressant medication. They were more efficient than older forms of antidepressant medication. They had fewer side effects. But when they were first manufactured by private pharmaceutical companies, they cost more money. Pharmaceutical companies invest an awful lot of money in research and development. It can take millions or billions of dollars to get medications onto the market. So when they first sell them, they're very expensive, and a lot of people can't afford them. But then, eventually, the patent wears off, and generic versions of the medications become available, and that's when you see dramatic dips. So here you see the dip in growth in spending was probably in great part attributed to the generic medications becoming available on the market. So nowadays, you can go to Walmart or a Target, and you can get a lot of generic versions of those SSRI medications for, I think, $4 for a 30-day supply and $10 for a 90-day supply. That's amazing. You couldn't have gotten that during this period of time. But we started to get that going into the 2000s here, which is antidepressant medication is just so incredibly inexpensive now, fortunately. Okay, so anyway, now let's go back to what we were looking at before here. And this is the mean number of annual visits for psychotherapy. In 1998, it was an average of 10 appointments, and then in 2007, it was an average of 8 appointments. Now, what I see is I have a subset of clients who see me a gazillion times, and then I have a lot of clients who see me only once or twice or 3 times, and they just don't continue on with therapy. So it seems like there's sort of a skewed representation in that sense. But the mean average in 98 was about 10 appointments, and it was about 8 appointments in 2007. So people aren't spending any more time in therapy per year than they used to. And also therapy costs less over time, even though cost of living was increasing over that period of time. And the total national psychotherapy expenditures reduced substantially in between 1998 and 2007. So when you see more people getting access to treatment, don't get too excited, because the unfortunate news is that's not necessarily psychotherapy or counseling. A lot of it's medication. And so you're counseling students. It's not like It's not necessarily true that more and more people are seeking counseling. In a way, that's true, but that's also because there are more and more people as time goes on. But it's not a larger percentage of the population than it used to be. And so we have a lot of work to do to continue promoting the many, many benefits of counseling and psychotherapy when it comes to mental health and substance abuse treatment, and not just looking for the quick fix with medication, because the quick fix has its drawbacks. For example, when you look at most research that looks at success rates with depression, patients who do medication only tend to get a more rapid alleviation of depressive symptoms. But in the long run, they don't tend to do as well as the patients who do psychotherapy only. And a lot of times the patients who do the best do a combination of medication and therapy, because therapy seems to work better for the long haul. But again, since people don't necessarily get the relief they're looking for as rapidly with therapy, because in therapy you're retraining the brain, and that takes time. But you get more long-lasting results from therapy. So that's about all I really want to say about this topic. Remember, you have another video to watch with the module for this week, and I will see you next week in class.